What lessons can medicine learn by listening to those who live it every day? What happens when patients advocate not just for themselves, but for others like them? The stories that shape the future of healthcare are the stories we tell today. This is the Patient Perspectives Podcast. Hello, and welcome back to the Patient Perspectives Podcast. I'm your host, Lauren Schoeller. I am so excited to be back to posting episodes. I took a brief hiatus as I was in the midst of a serious family emergency and then recovering from a personal illness. So thank you for your patience and understanding during that time. Um, this episode has been one that has been in the making for a little while, and I'm excited to finally get it out. Today we're talking about the pain scale and chronic pain. Now, chronic pain is often misunderstood, so I want to shed light on why the typical pain scale, which is your 0 to 10 pain scale, why it doesn't always capture the full complexity of what many patients experience daily. First, I want to fully acknowledge that the numeric rating scale, this pain scale from 0 to 10, it has its place in emergency situations for patients with acute pain as a way to help clinicians quickly assess the patient's pain level. So I don't want to dismiss the importance that the pain scale has in that regard. The pain scale is rather simple. It ranges from 0, meaning the patient has no pain, to 10, which represents the worst possible pain. I do find that it depends on the person who's asking it, which I will get into later, of whether the person is asking you to rate the worst pain imaginable versus the worst pain that you've ever experienced. And those are two different things to me. But the idea is to help doctors assess pain severity quickly so they can make decisions about treatment and management. It's a straightforward way to measure a highly subjective experience. But as useful as it can be in these urgent situations, it's not always the best tool when it comes to chronic pain. And for many people, chronic pain isn't simply a matter of how bad is it today. The experience is more complicated than what a number on a scale can reflect. So let's talk for a moment about what makes chronic pain so different from acute pain. Acute pain typically has a clear cause, like an injury or an illness, and is relatively short-lived. The body's natural response to acute pain is to alert you to something that needs attention. When the pain persists past the healing stage and it becomes chronic, that changes. It no longer serves as a warning signal, but instead it becomes an ongoing experience that's often invisible to others. It may come in waves or flare-ups, and it can feel like a weight that never quite lifts. Many chronic pain patients experience not just physical discomfort, but also the emotional and mental implications like anxiety, depression, and frustration as we navigate life with this persistent pain. Returning to the 0 to 10 pain scale, for people with acute pain, it's relatively straightforward to assign a number. If you just stubbed your toe, for example, it's easy to point to a specific number that feels right to you. But for someone dealing with chronic pain, the situation is far more complex. The pain isn't always constant. It might range from a dull ache to sharp stabbing sensations to an all-encompassing fatigue. And it might shift over time or from day to day. I know many people living with chronic pain, including myself, have struggled to communicate the nuances of their pain using the 0 to 10 scale. Pain isn't linear, it isn't a predictable curve, it's dynamic with layers of complexity. For some, pain might be mild but ever present, while for others it could be so intense that it takes over your whole body but intermittently. So how do you capture that in a single number? When pain fluctuates in intensity, location, and type, that number can become a source of frustration rather than a helpful insight for your medical team. One of the key challenges for chronic pain patients is explaining how it feels. Pain, as we all know, is a deeply personal and subjective experience. The way someone else experiences pain may not be the same as yours. Many chronic pain patients will tell you that it's hard to make someone understand the full impact of their condition when they can't see the pain. Now, this disconnect between what's felt and what's communicated is one reason the 0 to 10 pain scale doesn't always work for us. This pain scale is a one-size-fits-all approach that doesn't take into account the personal nature or the way chronic pain changes over time. As a personal aside, I also think a challenge with the pain scale is how it is asked, like I alluded to earlier. I've been asked, rate your pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever experienced. And I've also been asked to rate my pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain I could imagine. Now, these are two very different statements. I can tell you the worst pain I've experienced was uncontrolled post-surgical pain after my spinal fusion. However, the worst pain I could imagine is sustaining significant whole body burns. So comparing my current pain to either my post-op spinal fusion state or to being burned are two very different outcomes. Additionally, this will be discussed more later on too, but there's subjectivity on both sides of the scale. The patient's interpretation of the number on the scale and the medical professional's interpretation of the number, both of which are influenced by very personal factors. How do I know that my 5 on the pain scale means the same to my doctor who is interpreting it and using it for my treatment decisions? So what can we do about this? What's the solution for better addressing chronic pain? While the 0 to 10 pain scale is undoubtedly helpful for acute pain situations, it's becoming increasingly clear that it's not the most effective tool for those with chronic pain. Many healthcare providers are now starting to recognize this and are turning to more detailed and nuanced methods of pain assessment. These could include asking patients to keep pain diaries, keeping a log of the intensity of your pain, triggers, and any factors that might influence your pain can offer more insight into its patterns and its variability. Other descriptive scales, some medical professionals use tools that allow patients to describe their pain in greater detail, such as scales that ask patients to choose words that describe their pain, like sharp, burning, or throbbing. This adds another layer of specificity that numbers alone can't provide. I have also seen modified pain scales aimed more towards patients with chronic pain, and it's a scale from 0 to 14 plus with faces and descriptions of what those represent. There are also functional scales, which are scales that assess how pain impacts daily activities. For example, a scale that focuses on the ability to perform tasks like walking, working, or socializing, and this can provide a more full picture of how pain affects a person's life. As we move forward in advocating for better pain management, it's crucial that we acknowledge the limitations of tools like the 0 to 10 pain scale and seek alternatives that better reflect the lived experience of chronic pain patients. Now it's time for some audience insights about the 0 to 10 pain scale and chronic pain. I recently asked our Instagram community about their experiences with the pain scale, and their responses were overwhelming. Of the survey, 100% of respondents have chronic pain. 75% report that they are asked to rate their pain 0 to 10 at most of their doctor's visits, and 25% at all of their medical visits. So I asked, does the 0 to 10 pain scale accurately reflect your pain experience? Most respondents said no. They shared that chronic pain fluctuates, is influenced by multiple factors like activity level and emotions, and is experienced differently by each individual. A friend of the podcast, Kate Williams, explained what's a 5 for a person with chronic pain may be a 10 for someone with an acute injury. It's all relative. Others noted that their personal pain scale feels skewed compared to people without chronic pain, with one anonymous respondent stating, My 3 is a person who does not have chronic pains 6 or 7. My 8 or 9 on the pain scale would have someone else in an emergency room while I'm still debating if I should go. Jenna Boudreau shared that some people's pain can be explained on the pain scale, but for others with chronic pain, it's very frustrating because people don't understand that type of pain. Ashley Spalla added, chronic and acute pain vary, and chronic diseases feel like they can go beyond 10 when you're in a flare since we're used to pain all the time. The next question I asked about was, have you struggled to communicate your pain level using the 0 to 10 scale? Many respondents said they second guess their answers to make sure they sound believable to providers. Kate Williams said, I usually have a default answer of 5, right in the middle, so I know I'll receive some sort of treatment and hopefully won't be dismissed. In that same regard, I remember having an experience where I was at a physical therapy appointment and my physical therapist asked me what my pain was that day, and I was being seen for ankle pain. And it was at the end of a day. I had just had a long day at school, and so my pain was higher than if I was asked that at the beginning of the day. And I had said that my pain was a 5. And she looked right at me and she said, you don't look like someone who is in a level 5 of pain. And so it is really common to be dismissed and invalidated when you're just trying to provide an answer to it is a very frustrating situation when you're asked to put one number to your pain when you know that it can fluctuate so much, and how you compare it to certain other types of pain, it often feels impossible to answer. So others highlighted the difficulty of conveying pain that has no true 0, or pain that's hard to pinpoint. One anonymous respondent stated, the levels are relative. I have never known a true 0, so my 0 is a healthy person's 3 or 4. How do you convey that without sounding unstable or drug seeking? The next question I asked, what alternatives would you prefer to describe or measure your pain? A majority of responses suggested that pain should be described in terms of how it impacts daily life rather than assigning a number. Descriptive words like aching, sharp, dull were suggested, as well as questions about functional ability. Are you having to change your normal activities? Has it impacted sleep more than usual? Kate Williams shared, I personally think it would be so much better if we could describe our pain and how it's affecting our daily lives rather than basing it on a number. For example, using descriptive words such as sharp pain or aching is better for me than a number. Ashley Spalla also mentioned, I always equate what I'm feeling to another known injury, like this hurts as bad as my broken femur did. I also asked, has reporting pain on the 0 to 10 pain scale affected your medical care? Many respondents answered yes. Some reported receiving little to no treatment when their pain rating was on the lower end, only to later find out that they had a serious medical condition requiring intervention. Others expressed frustration at being disbelieved, with one person sharing, I have frequently been told I don't look like I'm in as severe of pain as I am. Kate Williams also said, the times I reported lower on the pain scale, I was usually sent away with either no treatment options or very minimal. And later, I learned that my pain was way more significant than I could ever imagine and required extensive surgery, which you can learn more about that in her episode that was posted a few weeks ago. Ashley Spalla added, yes, being believed is difficult, especially with complex regional pain syndrome and having a rare disorder that is not taught about despite the acute flares and emergent presentation. I also asked questions to our Instagram audience, and these are some perspectives from medical professionals. Interestingly, many providers agreed that the 0 to 10 pain scale is flawed. A pediatric emergency provider explained that they use it to assess changes in acute pain but rely on more functional impact for chronic pain patients. A medical student researching pediatric oncology pain shared that alternative questions such as how often does pain disrupt sleep can provide a clearer picture, and a nurse added, the numerical scale doesn't capture the nuances of chronic pain. Sometimes the faces scale is better, sometimes words are better, and sometimes you just can't put it into words. Kate Williams also shared that during her occupational therapy studies, she assumed a normal level of pain was a 5 until a classmate corrected her. Now she and her surgeon use a personalized pain scale as she navigates undergoing treatment for miserable malalignment syndrome. Another patient shared a breakdown of how pain affects energy, movement, and mood would be a better tool. And I have to say, all of these insights describe it so well. It can feel like an uphill battle trying to describe one's chronic pain, trying to be believed, and all of that plays into being able to receive appropriate pain management for one's pain. So I want to thank everyone who contributed to the survey and those who commented on my Instagram outreach for sharing all of this valuable insight. If you're listening to this episode and you live with chronic pain, I would love to hear from you. How do you describe your pain? Have you found tools or strategies that help you communicate your experiences more clearly? Share your thoughts with us on social media, and I look forward to continuing this important conversation. Thank you for tuning in to this episode of the Patient Perspectives podcast. Look forward to next week's episode where we feature an incredible guest. You'll hear more about that on Instagram later this week. I do want to say this month is February. At the end of the month is Rare Disease Day. I have a special episode planned where I will be highlighting voices of patients with rare diseases, including friend of the show, Abby Hauser, if you remember their episode on Ehlers-Danlos syndrome, owning their story and advocating for themselves. It was such a powerful episode. They will be featured in this Rare Disease Day episode, as well as many other incredible patients with important stories to share. So look forward to that, and thank you again for listening to this episode. If there are any topics that you would like to hear about, please leave a comment. New episodes drop Sundays at 8 a.m. Eastern Standard Time. Have a wonderful week.